There's been a lot of talk about Obamacare, which is also called the Affordable Care Act. How does the Affordable Care Act make Alabama stronger?
We've got a law. It's not going to be repealed. The Republicans in the House have attempted 40 times to repeal it. They're not going to. They're simply throwing red meat to their base. This is just a fool's errand so they can come home and say that they've done this. So this is really unfortunate that we're not spending some time seriously trying to figure out how to make this act apply to each individual family and make it work. And we can make it work. But we can't make it work if we're spending all of our time whining and crying because we got beat on the Affordable Care Act. Okay, it's a bad bill. It's hard to follow. We know that, but we've got to make it, change it, modify it in some way. We've got to make this Affordable Care Act something that benefits America. There's a lot we can do as individual Alabamians to help our health care be better for each family. Now, we're going to work on the Affordable Care Act. We're going to make it work for America. We've got to remember we've always done this. We've always had laws that had to be modified. Now, after the smoke clears, there are going to be some good things in the Affordable Care Act. We're going to want to keep them. And there are going to be some things that we don't want to keep. And a lot of those things that we don't want to keep, we're not keeping. America has a way over time changing things because we are an optimistic, can-do country. Can Alabama help itself? Absolutely. We can help ourselves. We know we don't need to smoke. We know we don't need to overeat. We know we have a lot of responsibility for our own health care. We know we need to expand Medicaid. We have to. Ask yourself this question. Look yourself in the mirror and say, is it better to diagnose a disease late or early? Would you like to see a young lady with an early breast cancer or a late breast cancer? Well, we've got some solutions. Let's turn out more doctors in Alabama. Let's have a 4-year medical school in North Alabama. Let's take our nurse practitioners and allow them to take care of the chronic illnesses that cost us a fortune. Obesity, hypertension, diabetes, bad habits. Let's ask the public to be more accountable. Let's ask them. If you want good health care and you want it to be affordable, you've got to do your part. Okay, so we got personal accountability. We've got a bad law we've got to modify. But what are we going to do in our community? What are we going to do for ourselves? Are we going to whine, get on our knees, and beg Washington to come down here and help us? We don't need that. We can do for ourselves right here. We've got the brains, we've got the innovation, we've got the creativity, and we know what we need to do.